Hello, my name is Ana Maria Chavez, and I'm the Executive Vice President at the National Council on Aging. As we continue to talk about the spread of the coronavirus, it's important that we really get a sense of what are thought leaders thinking at this point in time. I know all of us are looking at social media, we're looking at television for advice, but today I want to bring you a thought leader in this space who happens to be my boss and the CEO and President of the National Council on Aging. Jim, thank you for being here with me today, and thank you for bringing your perspective, which I think is right now an amazing moment in our country to think about how we interact with one another, but what we can do to be great civic citizens.
Thank you. It's great to be here. I do believe this is an important moment in history for all Americans, but especially older adults, to step up and rise to the occasion.
What is our responsibility as citizens, as individuals in this community, in this world? Talk to me about your opinions and advice and sort of direction for all the generations living under one roof at this time about how we can provide leadership in this moment and what we should want the history books to write about our actions and our motivations right now.
This is a moment in history for elders to rise and be the elders in their communities. The voice of perspective, the voice of wisdom, the voice of history, which helps younger people put this in context. We have to educate that everybody has a civic responsibility to help to contain the rate at which this virus spreads. We may not be able to prevent most people from being exposed to it, but it makes a huge difference if they get exposed to it over the next 3 or 4 or 5 years, as opposed to 3 or 4 or 5 weeks or months, which is the real risk right now.
We have a social and moral responsibility to address this issue in a frank, clear, but also accessible way. And then we're thinking about people who may not be at the table today, but need our resources and support and advocacy.
Absolutely. This issue is too big for just the government or just the healthcare system. This is going to require all the institutions in our society, the churches, the social service agencies, the senior centers with whom we're working are mobilizing right now to help people figure out what to do and to make sure people have been coming to the centers for meals, but those senior centers are also going to go out into the community to deliver more services and programs at homes. There's going to be a new normal. How do we live? How do we thrive? How do we take care of ourselves and our communities in a powerful way? So it is a crisis, but the Chinese symbol for crisis is both a crisis and an opportunity. And the opportunity here is for us as a nation to step up, and particularly for older people, to do the right thing for themselves, for their communities, and for the country.
Thank you, Jim. Again, this is Ana Maria Chavez with the National Council on Aging. Thank you for spending a moment with us as we discuss important issues not only for our communities but for you. See you again next time.